Well, thank you all for joining this call today. We're here because right now in Congress, Republicans are ramming through a mega bill that would gut healthcare access across the country, all so they can pay for tax handouts for billionaires. This big betrayal of a bill, which they are trying to get to President Trump's desk before July 4th, would be a $1 trillion hit to our healthcare system and the largest cut to Medicaid in history. Nearly 11 million people in America would lose their healthcare coverage. That is nearly 8 million people getting kicked off Medicaid, and another 3 million who would lose their Affordable Care Act marketplace coverage. And not only that, but Republicans are refusing to extend the critical tax credits that lower people's health insurance premiums, which will make another 4.2 million people lose coverage. And that will raise costs for everyone. People getting kicked off their health care, hospitals and nursing homes in our rural areas will shut down, small businesses no longer being able to afford to provide health care for their employees, and skyrocketing premiums for working and middle-class families. I can't emphasize this enough. The Republican bill is nothing short of a catastrophe for health care in America. And this legislation would be a massive hit to our state's budget. One estimate from KFF found that Washington State would lose around $32 billion in federal Medicaid spending over the next 10 years. There is just no way our state would be able to make up that shortfall. The Republican tax bill will strangle everyone who relies on Medicaid in red tape, creating more barriers to coverage through intentionally confusing and burdensome new work reporting requirements that could leave more than 620,000 Washingtonians without health care coverage or delayed coverage. The vast majority of people on Medicaid are already working. This bill is just a scam by Republicans to make it so hard to qualify for Medicaid that people just give up. And again, this bill will mean higher costs, less access to health care for everyone, not just people on Medicaid or the ACA. And you know, that is especially true in our rural communities, which stand to be the hardest hit by this legislation. One analysis found that 700 rural hospitals across the country would be forced to close under this bill. You'll hear more from Alex Jackson, who's with MultiCare, about how this bill would affect hospitals in central and eastern Washington. Now, my office has been flooded with calls and emails from people who are terrified about what the cuts in this bill would mean for them and their patients. An endocrinologist in Wenatchee wrote to tell me about how, after the ACA became law, they saw many new patients who had insurance for the first time in their adult life. These patients had been paying for expensive, over-the-counter insulin, but under the ACA, they were finally able to get better treatment with newer insulins and more advanced technology. And they wrote, quote, "If Medicaid cuts take away coverage for these patients, it will be like going back to the dark ages in terms of treatment," unquote. A doctor in Yakima wrote to tell me about one of their patients, an 82-year-old woman who has chronic pain and heart issues. Her Medicaid coverage pays for a caregiver, and it allows her to live at home relatively independently. Without Medicaid, all of that would fall away. A doctor in Spokane wrote to tell me how many of their patients are already suffering extreme financial hardship. Many of them can barely scrape enough money together for their appointments, and that is with the current levels of Medicaid support. And they wrote, quote, "These patients are our neighbors and community members, not criminal freeloaders, as some people seem to believe," unquote. Another person from Spokane explained how cutting Medicaid, meaning more care goes uncompensated, will exacerbate the existing shortage of mental health care in Spokane County. Now, Trump and his cabinet full of billionaires don't get it. But I have to say, for the life of me, I do not understand how some of the same Republicans who represent districts most reliant on Medicaid ever looked at this bill, looked at what it would do to the people they serve, and said, Count me in. So here's my message to everyone today. This is not over. We can kill this bill. It won't be easy, but we have to fight and we have to try. This bill is in the Senate now, and Republican senators are going to change it, which means if they can pass it, it will have to go back to the House again. In 2017, Americans across the country spoke out. They got loud. They took to the streets, and the wave of public outcry we created ultimately killed Republicans' first attempt at ACA repeal. So, blocking this healthcare heist is not out of reach. Republicans in Congress are not immune to public pressure, and neither is this administration. Your voice matters. Whatever you can do to speak up, please do it. For my part, I will not be quiet. I will keep sounding the alarm every way I can, talking to my colleagues, lifting up the stories of people who would be hurt by this bill. We have a big task in front of us, but we've stopped Republican healthcare repeal before. We can do it again. Thank you. And now I will turn it over to Washington State Senator Marcus Riccelli.
Well, thank you so much, Senator Murray, and thank you for your leadership. We certainly are hearing the message loud and clear. Kill this bill and don't kill people. For people in Spokane and across Washington State, these proposed federal Medicaid cuts represent a real threat to basic health, access to care, and financial stability. There is no doubt this legislation will force many of our rural hospitals and clinics to close and lead to increased wait times and reduced services in urban areas like I represent. It's clear many people in Spokane and Washington will face unneeded health risks and suffering. We were one of the first states to expand Medicaid on a near unanimous bipartisan vote in 2014, which helped thousands of people get the care they needed. Since then, we've expanded that coverage because here in Washington, we believe healthcare is a human right. Over half the children in Eastern Washington are on Apple Health and over 2/3 in Central Washington. Cuts would be devastating to our goal of a healthiest next generation, particularly with reductions in preventative care and oral health care. Further, children on Medicaid with high medical needs will lose access to specialty care. Babies won't be diagnosed and they'll be severely impacted or worse. Everyone will suffer. In Spokane County, over 35% of the population is covered by Medicaid. Pulling the rug from underneath thousands of people in my community and across our state and across this country will mean a lot of comprehensive services to people. This means reducing or eliminating access to primary care, behavioral health, and dental care. This means delaying care. This means floods of people ending up in the emergency room that did not have to be there. We've been focusing on going upstream and trying to make people well and get healthier. This will completely upend that. And let's be clear, the more people that end up in our hospital systems, the more expensive it will be on our already overburdened system. One patient in our area who nearly died due to a collapsed lung was able to receive life-saving treatment because he had Medicaid. After treatment and physical therapy, he was able to start work again and support himself. Now he's able to afford his own insurance. These stories will be a thing of the past, and many of these patients will lose their lives. The hospitals are already stretched thin, and they'll struggle, particularly again in our rural areas. Hospitals will close, and again, all those burdens will be felt, whether you're in an urban or a rural area. This doesn't even speak to the financial burden that Senator Murray was mentioning. Working families will face significant costs to treat chronic illness or a trip to emergency room, which is already overwhelming enough. I passed a bipartisan bill focusing on medical debt from credit score reporting. Medical debt is still the #1 cause of bankruptcy in America. 6 in 10 Washington adults already say they can't pay an unexpected medical bill, and 3 in 10 Washington residents say they live in a household with medical debt already, even with insurance. Can you imagine if these cuts happen, if you're even able to find care, now what you'd be faced with? So I strongly believe and appreciate Senator Murray's leadership that cutting Medicaid will mean cutting the lives of Washingtonians short. And I appreciate the time to share the perspective coming right out of our community in Spokane. And I think it's impacting people across our state significantly. Stop this bill.
Good afternoon. My name is Alex Jackson. I'm the Senior Vice President and Chief Exec of MultiCare's Inland Northwest and Central Valley region. MultiCare is a not-for-profit, locally governed, comprehensive system of health, and we provide care to thousands of patients each day in Washington across the Pacific Northwest. And we provide all flavors of care: inpatient care, intensive care, behavioral health care, primary care, urgent care, pediatric care, specialty care, We also have a lot of outreach in the community as well. So on behalf of MultiCare, I appreciate the opportunity to join the senators and others today to discuss how the healthcare provisions in the One Big Beautiful Bill Act will impact patients in our community and the delivery of care in the state of Washington. First, from a patient's perspective, the biggest concerns about the act are the numerous provisions that will make it harder for patients to get health insurance coverage and keep that coverage. Some of those barriers include a shortened enrollment period, requirements to purchase insurance via the health benefits exchange every year. Right now, patients are automatically re-enrolled. Requirements to verify individuals on Medicaid expansion every 6 months. Requirements for those in the expansion population to verify work status, again, every 6 months. And as Senator Murray said, there are estimates this will impact thousands of people. 400,000 to 600,000 people in the state will lose insurance in Washington as a result of these provisions. Yet, when people lose their coverage, their medical needs don't go away. In fact, look at health insurance coverage. The lack of health insurance coverage can end up exacerbating those needs, as patients without insurance generally don't receive the preventive care that they desperately need that keep patients and populations healthy. Patients may even ration food or skip medication altogether. All this adds up to patients who, when they do seek care, will require higher level care, which is also more expensive. In addition, they often enter the healthcare system through an emergency department. In addition, putting increased stress not only on them, but on other patients needing emergency department care as well. In accordance with our mission in MultiCare, we provide care for all who need it, any day, any hour of the day as well, irregardless of their ability to pay. When patients lose access to health insurance, health systems like MultiCare will have no choice but to care for those patients and absorb the increased costs associated with providing uncompensated care, creating a financially untenable and unsustainable situation for health systems. Ultimately, we may have to cut services, causing entire communities to lose important access to care. For smaller hospitals and health systems, particularly those in rural areas that have already been mentioned today, they may have no choice but to close their doors entirely, leaving those communities without access to even safety net services like an emergency department. And not only that, it will also close likely the largest employer in that community as well. Thanks for the opportunity to participate.
Good afternoon, everyone. My name is Alex Cordova. With Yakima Neighborhood Health Services. Here, our community health center has 9 sites and 3 mobile units in the Yakima Valley. We provide over 150,000 visits every year to the working poor in our communities. Last year, we provided over 90,000 visits to patients on Medicaid and qualified health plans insurances. We estimate about 1/3 of our patients will lose their health coverage, not because they are not eligible, but because of the heavy administrative burdens or because loss of the subsidies will make their coverage unaffordable. Our community health center has been a Navigator lead organization since 2014, the beginning of the Affordable Care Act. Our navigators cover 6,600 square miles, mostly rural, between Yakima and Kittitas County. We have completed over 200,000 Medicaid and health benefit exchange applications during that time. And we have heard a lot of family stories about what makes healthcare accessible and affordable. Most of our help has gone to helping people apply for Medicaid. And if they make just too much money for Medicaid, then we help look at their options through the exchange products. Most of the people we help are working, disabled, or have children in the home they are caring for. We're really worried about the proposed changes will do for our families, and so are they. Recently, we had a family of 5, parent working as a construction worker. Their children did qualify for Apple Health. Unfortunately, the parents did not. They were a little bit over income by like $150. Then we did help them explore the insurances through the exchange, but they were grateful for the help, but they were just worried losing subsidies will make it harder for them to have insurance in the future. We also see a lot of Medicaid coming in, a lot of clients with Medicaid coming in, and they are fearful for the future. They ask, what's going on? What's going to happen to my coverage? How exactly is this going to affect my family? So just right now, open enrollments from November 1st to January 15th, but these changes is going to shorten the open enrollment period by a month. And right now, also losing tax credits is going to make it harder for families to get an insurance through the exchange. So we're supposed to be moving forward, not backwards. This year we had an open enrollment that was amazing. We had a lot of people getting coverage. Moving forward, this year coming up, we feel that's going to go backwards. So this changes is going to make a lot of changes for families to afford coverage. Thank you.
Hi, my name is Julie Sparkman. I'm a home care provider. I'm a proud member of SEIU 775. I live in Spokane, and I just want to say thank you for the opportunity to tell you this story today about why we must protect Medicaid, what it really means when we're talking about cutting healthcare, especially in rural communities. So almost exactly 2 years ago, my grandson Magnus was in just a horrific car accident. It happened outside the city. He was 4 months old. One moment he was a perfectly developing, happy joy to be around, and the next moment he was being rushed to Sacred Heart, and he was fighting for his life. By the time my daughter and I, who were both at work, arrived at the hospital, Magnus was already in the pediatric ICU. He was being worked on. He had suffered cranial fractures, multiple brain bleeds, broken ribs, internal organ damage, and the doctors told us that the chances of his survival were close to none, and to prepare for end-of-life care. Those were the worst 3 days of our lives. We just lived them 5 minutes at a time. We didn't want to step away to sleep or to eat or to use the restroom for fear of what we would find when we got back. But Magnus made it. He spent a month in the ICU, in the hospital, in different beds. And what saved him, it wasn't luck, it wasn't a miracle. It was the infrastructure that we have so painstakingly built over time. It was the ambulance drivers, the ICU beds, the machines, the skilled nurses and doctors. It was all of those things that kept him alive against all odds. And every bit of it was supported by Medicaid. So that is what is at stake. When people talk about cutting Medicaid, especially to those rural areas, they're talking about shutting down hospitals, losing emergency care, removing access to life-saving treatment. I mean, Magnus didn't have time to be transferred. If the nearest hospital would have been hours away, we would be having a very different conversation. And that brings me something that I just need for people to hear. They say that nobody is guaranteed tomorrow. My concern is, what if your tomorrow comes and the person who matters most in the world to you doesn't come with it? That's the reality when our hospitals are closing, and that's the risk when we gut Medicaid. Magnus is too. He's thriving. I have his smile still in my world, and his mother couldn't be happier. I support our family with my work as a home care provider. And here's the truth of that. Healthcare workers are going to have to leave the field. Caregivers like me are emotionally preparing to leave this job. And we don't want to. We love what we do, but love doesn't buy groceries. We will still have rent. We will still have all of those needs, and so will every other healthcare provider. If Medicaid is cut by hundreds of billions of dollars, caregivers are going to lose hours, wages will be cut, benefits are going to disappear. So many of us just won't be able to stay on the field. And if we leave, it's not just going to be a workforce problem, it's going to be a care crisis. Clients would go without support, families would burn out, rural communities are completely left behind in all of this. And none of this is theoretical. Accidents are going to happen, illnesses are going to happen, aging is going to happen. Emergencies don't care where you live or how far the nearest hospital is. You don't get to come out of an ICU by accident. It takes skilled people and working system and resources. We built this safety net for so many reasons. And all of those reasons are people. People in crisis need somewhere to go and someone to help them. And we just can't abandon it. So that's why we need to fight to protect Medicaid, to protect our hospitals, to protect rural healthcare, because nobody should lose everything in one moment if they have the opportunity to prevent that. Thank you.
We'll go first to Samantha.
Hey, this is Sam Wolfile. I'm with the Inlander newspaper in Spokane. I was wondering if Alex Jackson with MultiCare, if you could speak to the percentage of patients that you have within the system who might be impacted by these changes in Medicaid.
Great question. It's a lot. I don't have the exact number, but it's a lot. We care for hundreds of Medicaid patients each day in Spokane and Yakima and Olympia, in Bellevue and in Tacoma. So it's a lot. It's a significant portion of the patients we serve each day.
Thank you. And Senator Murray, I apologize. I'm not super familiar with the congressional process as much as I am with the way that these bills move through the state. You mentioned that they're trying to get this through to the president's desk by July 4th. Do you have a sense of when we might start seeing a vote on this, or some of those amendments that you mentioned the Republicans and Democrats might bring forward?
Well, the House has passed the bill. It is now up to the Senate to either make changes or pass the same bill. And if they pass the same bill, it goes directly to the president. Right now, there's a number of Republicans who are expressing concern about various components of the bill and changes that they're going to make. And they are planning on having that before us in the Senate to vote on the week before July 4th. If they make changes, which I believe they will, it goes back to the House. They will vote on it and then send it to the president.
Great. Thank you so much.
So it's coming up fast, and that's why it's so important that people understand the critical impacts that this bill is going to make on their lives. They may not be watching what's happening in D.C. or hearing what's going on, and all of a sudden find themselves a few months from now with huge bills for their insurance, whether they're on private or on the ACA, or hard to get onto the ACA, or their Medicaid going to be impacted. So that's why it is so important people let their member of Congress know now that they do not support these kinds of dramatic cuts to our healthcare system. I do want to raise one other point. We could ask, why are they doing all these dramatic cuts to people who rely on healthcare? Well, it's for one reason. This bill is essentially the way cutting these programs gives them the resources they want to have to lower taxes for multi-billionaires. So that's what this is all about, is creating space to cut taxes for people who really don't need it.
Great. Next, we'll go to Philip with KHQ.
Thank you, Senator, for making yourself available for this. I actually have two questions. My first question would be that when we sit there and we look at the impact of this bill, it's not just those that are relying on Medicaid, it's other insurance companies that are seeing the potential impact on this as well, and are now asking. I've got 13 different insurance agencies that recently requested through the state that they could actually increase rates, some by as much as 37%. The average on these is 21% going into next year. So even those who are not on Medicaid could potentially end up paying for this should this bill go forward. Can you please comment to that? And are these insurance companies also part of the problem? Are they trying to capitalize on this?
Well, the fact is what will happen is if we lose this many people, 8 million people losing Medicare, another almost 8 million for the changes to the ACA, then those people, as I believe Alex Jackson said to you, is they're going to still want health care. They will come to our healthcare system. They have costs associated with them. The only way to pay for that is for everybody else who comes as a payer into the system will have their costs raised. So insurance companies are telling us that beginning this fall, everybody who is on insurance, not ACA or Medicaid, will have to have their costs increased because the overall cost of providing health care to all these people who will no longer have it impacts everybody.
May I ask my other question very quickly, ma'am? I want to also speak very quickly about what this bill does with VA health. Veterans also very much in need. Are there additional cuts going on there? Are there additional resources that potentially could be coming in? Our veterans right now, we've got one man in Washington that's on the run, family saying that the system failed him, that there wasn't enough resources available through the VA. Can you speak to that, please?
Well, that is a separate problem and one I have always been extremely concerned about, and that is our VA medical care. Obviously, the person that you spoke of, we have seen a lot in the press about the fact that he needed treatment for PTSD and was not getting what he needed, apparently, or perhaps not getting through the VA. What concerns me about the VA, separately from this bill right now, is the Trump administration has come in and cut dramatically the number of employees in our VA healthcare system. Harder to get an appointment, harder to get the right kind of care you need. You don't have research going on to deal with things like PTSD because that has been cut totally separate from this, but part of their budget request and what they've been doing through the dramatic cuts, the DOJ cuts that we keep hearing about already. So that compounds and complicates this tremendously.
Great. We'll go over to Jasper with the Yakima Herald Republic.
Thank you. Senator, you're in and out of Congress, you're in and out of the Senate. You know how that works much better than all of us. What kind of changes do you expect to see or do you think we might see to this bill in the Senate? You've talked about that being a possibility. What would you anticipate there?
Well, they have a real problem in front of them because the only way that they can get the amount of money they need to provide the tax cut for ultra wealthy is to cut Medicaid. So that's exactly what their bill does. That's exactly what they're going after. And maybe they won't be able to pass it if enough people speak out and say, "Don't do this to us." That is the hope that we have right now.
Thank you.
We'll go to May with Cascade PBS.
Thanks. Alex, I have a question. Can you talk about what service lines, or you mentioned, there's been a lot of talk about hospitals possibly closing or clinics closing. Within the Medicaid system, is there certain clinics or hospitals within your system that will be more at risk if this goes through, or service lines that might be more at risk of being cut because of this massive Medicaid cut?
Yeah, so first of all, I want to say that as Senator Murray said, that this is the time to share our voice. And what I was trying to do today is to share the impact on patients in the state and the delivery of care. And so, we need to see what occurs here in the next few weeks through advocacy and other means. But less dollars coming in the door will put clinics and hospitals in a place where they have to make difficult decisions that ultimately will impact patients' access to care. There's a number of hospitals in the state of Washington right now that are on the financial edge, and it will place a burden on all hospitals, and particularly those hospitals that are smaller and maybe less sustainable as well. And so that's the concern is the impact of this bill in access to care, because hospitals and clinics may have to reduce access to care, which will make it a greater challenge for those patients. And then this will impact not just Medicaid patients, it's important for people to know, but folks with Medicare and commercial insurance as well.
May I ask a follow-up question? Okay. Alex, as you're aware, Yakima has experienced a lot of cuts already. And independent of this, we lost a hospital, in the last few years. We had another hospital that ended its maternity care, their OB care because of cuts. And so the hospital that you're running is already having to bear a lot more workload. And so can you talk about how this would impact kind of already a strained system in the Yakima Valley?
Yeah, I think you identified some of the things that could happen with the impact of this bill and these provisions, as well as that we will see more closures of clinics, services, and perhaps hospitals with emergency rooms as well. And so that's the impact and implications that I want to bring forward for the delivery of care in Washington. And certainly,
Alex, I think we might have lost you. If you want to pick up.
Okay. So I'm not sure where I left off, but I'll give it another whirl. I think, as Senator Murray suggested, this is the time to share the impact on patients, populations, and the state of Washington. And if these cuts come into place, it's going to bring less dollars in the door for clinics and hospitals, which will put financially strained hospitals, and many in the state of Washington already are, in a place where they'll have to evaluate services to close, shut, and there may even be some hospitals that may have to close based on reduced revenue coming in through Medicaid programs. And what's important too is what we're talking about mainly is Medicaid today, but if a hospital or clinic closes a service, it impacts Medicaid patients, Medicare patients, but also commercial patients as well.
And we have time for one more question. Looks like we'll go back to Samantha.
Yeah, if I understood right, Alex Cordova, did you say that you help sign patients up for Medicaid through your role?
Yes.
Can you speak to this shortened time frame for the ability to enroll and what that might look like? I understand that already with the enrollment window, it tends to be really, really busy towards the end of that. And I know it's just like extra hours for people helping get people enrolled. What might this look like if that gets shortened?
So for Medicaid right now, Medicaid you can enroll all year round. So what we're talking about, the shorter period, is for a qualified health plan through the marketplace, through the exchange. That one is right now, it normally is from November 1st through January 15th, but they're talking about shortening it to December 15th. So on that one, we'll probably see more clients coming in, or if things change, we probably won't see clients coming in because it's not going to be affordable.
Thank you.
You're welcome.
All right. I'll just give folks a second. If anyone has one last question, I am not seeing any hands raised. Oh, we'll go back for our last question to Jasper with the Yakima Herald.
Sorry. Yeah, Alex, I wanted to ask, you talked about people you work with just not being able to enroll. What happens to those folks if they're not able to get this health care? What do you see as the options for them or the results of these changes if they can't get on Medicare or Medicaid?
First of all, I think likely patients will defer care. They'll choose not to come in because they don't have access to health insurance. And then when they do come in, we find those patients to be more ill, needing more comprehensive, intensive care. But ultimately, we will serve them often through the emergency department, and we'll care for them like anybody else. And then we will provide charity care to those patients. But likely, they'll be accessing healthcare through emergency departments.
Fantastic. And can I put that question to Mr. Cordova as well?
Yes, of course. Just like Alex mentioned, it'll be a ripple effect. It will affect everybody. Your clients within our clinic, if they don't have insurance, we're still going to see them. We do have a sliding scale regarding on your household size and income. So we won't deny anybody. But if they won't come to us, sometimes a lot of people go to the emergency room. But we try to educate them, come to your provider first. But if this changes, we do see a lot of people not even going to go search for any care, because it's gonna be a burden on the payment on whatever services they're trying to get.
Alrighty, not seeing any other hands raised, we'll turn it back to Senator Murray to close this out.
Yeah, thank you very much for everybody who's listening in, but I also want to thank all of the folks who shared their personal experiences about this. This is going to have an overwhelming impact to every single person in this country, and I just want to remind everybody, we have fought these kinds of battles before. When Trump was first in office and tried to repeal the ACA, we stopped that in the Senate because people spoke up and they said, don't take my health care away. Don't have these huge impacts on our communities. We want to make sure that we can provide health care at an affordable cost for all Americans. So now's the time to speak up. Thank you.